Meanwhile, Public Health Director James Gillan wants to clarify his position regarding physician involvement in preparation for FestPac and concerns over a possible Zika outbreak. Gillan says he absolutely supports and welcomes any help he can get. PNC's Janela Carrera has more.
It was all one big misunderstanding about the involvement of the Guam Medical Association for the FestPac activities this summer that will draw over 13,000 visitors to the island, some from Zika endemic countries. A meeting was held yesterday at Adelut for a FestPac organizational committee that covered many aspects for planning at FestPac, including preparation for potential Zika contamination on Guam. GMA President Dr. Tom Shieh was initially invited, but later did not attend. Department of Public Health Director James Gillan.
So I invited him, okay, forgetting that Rose Ramsey is the chairperson. She runs the whole show, and I didn't ask her. That meeting is not just for public health and not just for Zika. It's the whole group, every subcommittee, every subgroup.
You know, thanks for clarifying, what transpired yesterday. And, for me, as, this is my specialty. We take care of pregnant women.
In addition, Gillan clarified his comment regarding a specialist that GMA plans to bring to Guam to educate physicians about Zika and the unborn baby. The physician, maternal fetal medicine specialist Dr. Greg Hirata from Hawaii, is double board certified and heads many other organizations in Hawaii. Dr. Shieh emphasizes that his expertise is crucial to the Pacific region, as he is the only maternal fetal specialist accessible to the area.
Dr. Shieh was saying, we've got a guy well-known, Dr. Keith Hirata, who absolutely is probably the best choice to have to come out here to provide the education and information for all of the physicians.
But the bottom line, says Gillan, is that physician and healthcare involvement is instrumental for FestPac planning.
Public health, GMA, there is a goal to work together.
No question. And I think we have to realize that we're really running on about probably at least 3 tracks.
The first, he says, involves logistics. Next is the environmental aspect, such as elimination of mosquito breeding sites.
And then, of course, the actual health service track. Okay, are we going to man all of the tents, staff all of the tents? Are we going to have people at the residential sites, the schools where the delegation is going to be staying?
Gillan and Shieh spoke about GMA physicians and nurses volunteering to man tents during FestPac as a first line of defense and treatment. Guam Memorial Hospital Chief of Staff Dr. Chris Beeling says the hospital is prepared for any emergencies, but he emphasizes that a Zika infection will likely not be diagnosed in an emergency room.
Now, Zika is not going to generate any acute emergency room visits because the illness is very mild in adults and many times even asymptomatic. That's actually what makes it so treacherous. Well, it's important to avoid panic.
Oh, of course.
Yeah.
And that's what, we don't want to get that scare-bola thing that we had before.